Imagine living in the Caribbean in the early 1980s and suddenly experiencing strange lesions on your body, intermittent fever, unexplained weight loss, and a general sense of being unwell. You hear that there's a new disease that can lead to a painful death. Imagine as well trying to understand what is happening to you, why it's happening, who will treat you, and where you can get help. And a medical community that does not understand your ailment, how it is spread, and more importantly, how to treat it and how to give you some comfort and relief from your physical and mental anguish. This, ladies and gentlemen, would have been the scenario some 30 plus years ago when HIV and AIDS first emerged, and when ignorance, stigma, and discrimination led to a painful disease progression and a lonely death. You will agree that from when the first case was diagnosed in the early 1980s to the 1990s, when the Caribbean was described as being second only to sub-Saharan Africa in terms of HIV prevalence, to the present day, where now there's an estimated 35.3 million people living with HIV, many of whom now receive treatment, we have come a long way. We now have a better understanding of the disease, its transmission, and its progression to AIDS through the initiatives, hard work, and dedication of healthcare professionals, and from the assistance of donors and civil society and leadership from the Ministries of Health in the Caribbean. The natural progression of HIV and AIDS in the Caribbean caused pioneers to emerge and best practices to be developed. We have, for example, in Antigua and Barbuda, Sir Prince Ramsay, who was just recognized once again for his sterling contribution to the control of the epidemic, and as one of the few physicians that dedicated most of his medical practice to not only treating persons diagnosed with HIV, but also educating the public. Fortunately, today, we have more physicians and other healthcare workers in the Caribbean and in Antigua and Barbuda who now understand more about HIV and AIDS and are confidently treating patients. We have our present clinical care coordinator, Dr. Beezer, who's here as well. I want to recognize as well Mrs. Felicity Amer, as Sir Prince mentioned, was the first AIDS program manager in Antigua and Barbuda, and her successor, Mrs. Janet Weston. The manner in which our healthcare professionals can now treat HIV and AIDS is a result of the training provided by the Caribbean HIV and AIDS Regional Training Network, more commonly known as CHART, and the formulation, implementation, and use of clinical guidelines that have been adapted to Caribbean nationals. Another best practice regionally has been the establishment by the Caribbean Community, or CARICOM, of the Pan-Caribbean Partnership Against HIV/AIDS, or PANCAP, a regional umbrella organization that brings together national HIV programs with regional and international organizations involved in the fight against HIV in the Caribbean. As a sub-region, the countries of the Eastern Caribbean established the OECS HIV/AIDS Planning Unit, or OECS HAPU, described in some fora as another best practice that has paid particular attention to the HIV response in the Eastern Caribbean. In any description of Caribbean best practices for HIV, it would be remiss of me not to mention the Lady Mead Reference Unit in Barbados that functions as an ambulatory care clinic and a state-of-the-art laboratory providing viral load testing, CD4 counts, and confirmatory testing for persons not only in Barbados, but further afield in the Caribbean, leading to earlier diagnosis as well as improved disease monitoring. We have as well in the Caribbean, through international donors and partners, including the Clinton Foundation, the Global Fund for AIDS, Tuberculosis, and Malaria, and the President's Emergency Fund for AIDS Relief, or PEPFAR, and others, been able to provide antiretroviral medication and supportive programs in the treatment of HIV and AIDS. These donations, though beneficial, have reinforced the important lessons that donor funding does not last forever, and that we need to use such resources holistically for health system strengthening and not only for HIV treatment. It has also taught us that we need to develop innovative mechanisms for healthcare financing, such as national health insurance, and to use other best practices such as pooled procurement for pharmaceuticals, as currently practiced in the OECS through the Pharmaceutical Procurement Service, or OECS PPS, for the procurement of antiretroviral medication at competitive rates. Treatment options, therefore, are more readily available, and persons with HIV and AIDS are living longer and dying of other conditions, including complications of chronic non-communicable diseases such as diabetes and heart disease. We all also now live in an era where the term AIDS orphans, which was applied to children whose parents died from HIV in the early phase of the epidemic and who were rejected by other relatives, is truly a thing of the past. Their survival into adulthood and their ability to live productive lives contributing to society is a reflection of social support systems established by governmental organizations, as well as the significant contributions made by civil society organizations, NGOs, and religious bodies in our region. With the recognition that HIV is transmitted from mother to child, many countries in the Caribbean have established successful prevention of the mother-to-child transmission of HIV/AIDS. And in fact, there is now a regional move for the Caribbean to be the first in the world to eliminate the mother-to-child transmission of HIV, a goal that is well within our reach given the Caribbean's track record in the elimination of smallpox, measles, and polio. HIV brought most at-risk populations to the fore and forced us to focus on not only the fight for proper treatment, but also for equal rights, policies, and laws that do not foster stigma and discrimination. We must not forget in our response our most at-risk populations, such as those who are incarcerated, men who have sex with men, and situations that place persons at risk, such as violence against women, sexual abuse, and human trafficking. We must continue to develop, enact, and enforce legislation that deal with these issues. Ladies and gentlemen, from a Caribbean perspective, the regional response to HIV and AIDS has been commendable, given that we are small island developing states with fragile economies. This response has led in summary to best practices and pioneers in the medical fraternity, innovative health financing mechanisms to mobilize resources, and a strong foundation that will facilitate us being the first region to eliminate the mother-to-child transmission of HIV. Despite these gains, we do have an unfinished agenda that includes reducing the sexual transmission of HIV by 50% by 2015, an international target, eliminating infections among children, reaching more persons living with HIV with life-saving antiretroviral medication, reducing tuberculosis deaths among persons living with HIV, eliminating gender inequalities and gender-based violence, and increasing the capacity of women and girls to protect themselves from HIV. We also need to eliminate HIV-related stigma, discrimination, punitive laws and practices, and eliminate HIV-related restrictions on entry, stay, or residence. How can we do this? Looking at these goals as solely the responsibility of ministries of health makes them impractical and unattainable. However, if as a region we adopt initiatives such as health in all policies, we foster public-private partnerships, embrace information technology, social media, and last but by no means least, utilize the power and influence of the media, we can attain these goals and much more. Let me use this opportunity to emphasize, endorse, and encourage the involvement of Scotiabank and the Caribbean Broadcast Media Partnership in the fight against HIV in the Caribbean over the years, as an example of a partnership that has truly worked and continues to foster a positive Caribbean HIV and AIDS response. Their stewardship needs to be adopted by other private sector organizations, not only for HIV and AIDS, but also for other diseases that negatively affect economic development in the Caribbean, such as non-communicable diseases. It is truly a shining example of public-private sector partnership at work. I want to also take this opportunity to urge members of the public to get tested, know their status, and in so doing protect themselves and their families at Scotiabank's during the regional testing day later this year all over the Caribbean. Thank you.